Limb lengthening surgeries. Today we are going to talk about a very important topic about the limb lengthening surgery. Friends, we do limb lengthening surgeries in many indications. When someone wants to increase their height, when one leg is shortened due to a genetic malformation or infection or previous fractures, and they want to make the height of that particular limb equal to the other limb. Due to the technical advancement, lot of good implants are available now in India about the limb lengthening surgeries. In initial days and now in many centers, limb lengthening is done by the Ellis Rove. Ellis Rove is a kind of external fixator which is fixed to the thigh bone or the shin bone tibia, and the patient has to increase the length of the Ellis Rove by the bolts every day. So it is quite cumbersome, it is very difficult to manage, there are chances of infection, and obviously there is a big cosmetic loss because there is a very big external fixator applied over the thigh bone. But due to the technical advancement, now we have intramedullary limb lengthening system in India as well. This system has an intramedullary nail which we surgically put into the bone, either the thigh bone femur or the lower bone shin bone tibia, and with the help of one external device which has magnets, we can increase the height of the nail every day. So it's after the surgery, it's very simple. The patient has to just press a button and the length of the nail will be increased by some amount. In this system, we can achieve at least 6.5 centimeter of lengthening of your bone, and there will be no external fixator applied on your thigh or the leg. Nobody can tell that you have undergone a surgery. There is a negligible chances of infection, and we will increase the height of your bone at least by 6.5 centimeter. So if you think that you want to increase the height, you have some kind of deformity in your lower limb in which one leg is shortened than another one because of previous infection, previous fracture, malunion, in some places by birth, then we can do this surgery and we will be increasing your height up to 6.5 centimeter without any use of external fixator, with the precise true intramedullary nail which functions on the basis of very rare earth magnets.